for most of us, actually, we do think that we are having constipation as long as we are having hard, lumpy stools and straining, which is okay. It's fine. That's also acceptable as a symptom for constipation. Now, one thing that I want to highlight here and want everybody to understand is that constipation is a symptom. It's not a disease itself. So please remember. So when you're having a constipation, it doesn't mean that you're having a disease. It's just a symptom. And in fact, there are many causes that you will realize here that can contribute to constipation. Okay, how prevalent is the constipation? In this case, we are talking about chronic constipation, right? So the prevalence of chronic constipation, if you look at it, compared with other gastrointestinal disorder itself, actually is quite high, I think that it's only second or third to the dyspepsia, which is indigestion symptom, and functional heartburn. So actually, dyspepsia and heartburns are probably the same types of underlying what I call category of problem, because the heartburn is also a symptoms of dyspepsia itself. So therefore, other than indigestion symptom, chronic constipation constitute one of the highest prevalent rate in the population. And some report can even indicate that it can be as high as 28% in the population itself, right? Now, between the constipation or the population we have, there's two subgroup of population that actually have very high prevalent rates of constipation. If you look at this chart itself, the two special group of people that were likely to suffer from constipation are the elderly, those that is above 60, and the pediatric, which is actually children that's younger than 6 years old. So these two are what we consider as a special population, which have a high prevalent rates of constipation. And we will discuss the strategy and management strategy, how to deal with these two special groups. For general population, actually the prevalent rates of constipation are not high. For most of us below 60 years old and a young adult, generally the constipation is about prevalent rates about 6% most. Okay, types of constipation. So basically, constipation can be classified into two main categories. Primary constipations, or we call it functional constipation. Actually, this type of constipation occurs without an identifiable organic or structural cause, which means that it's an unknown cause of constipation. So, and the management of this type of constipation will have to basically rely on our dietary habits, lifestyle changes, and also to some extent with helps of some laxative application, laxative itself. Now, secondary constipations are constipation caused by an underlying medical conditions, or medications, or our physiological or structural abnormality of the body itself. Right. So this actually, the management of this secondary constipation actually is to address the underlying condition, take care of the underlying condition, and then at the same time provide symptomatic relief to the constipation. So there's two very distinctive approach in the management of it, depending on the type of constipation. So it's important for us in management of constipation itself, first of all, to really differentiate the constipation, whether it's a primary or functional constipation, or is due to underlying medical condition. Right. So it's important because the management approach is different. Okay, let's look at the chronic constipation. Actually, chronic constipation can be also further subdivided into their etiology. That means the cause, the mechanism that causes it itself. So you can look at it itself. There are actually 4 subtypes of chronic constipation. We can actually classify them into 4 subtypes. The first type is the normal transit constipation, whereby the bowel movement, the transit of our food through our GI site is actually normal, right? Constipation that actually does not have a clearly underlying cause. This is what we also call functional constipation, right? This is the common subtype that occur for the children and the older adult, which is the special group of people that is having high prevalence itself. And you can see from there that the normal transit subtype actually is the most prevalent. It's actually it amounts to about 60%, right, of the total constipations incidence itself. So next is actually the defectory disorder. In this case, this is actually a problem with the nerves and muscle of the rectum, right? So usually this is due to mechanical obstruction itself, right? So you can see from here that you will have some obstruction, and therefore the muscles and the nerve control of the rectum here is affected, right? So this accounts for about 25% of the prevalent rates of chronic constipation. Then followed by a slow transit. Slow transit is actually the problem with the nerve and muscle of lower intestine. So this involves the lower intestine part, not the rectum, but rather the whole intestine part itself. So the movement of your discharge of your stool is actually getting very slow. The transit is slow, right? And this is usually caused by medication or metabolic disorder like diabetic conditions itself, right? Then we have a special class of subtypes of chronic constipation. Actually, it's constipation with IBS. IBS actually is a very prevalent, complex, irritable bowel syndrome. It's actually a digestive disorder, right? And this disorder is resulting of the brain and the digestive system connection, the communication between brain and digestive system itself, right? And this type of constipation itself can actually lead to various symptoms, including constipation. IBS itself can also lead to diarrhea. And then you also can have both diarrhea and constipation occur at the same time. So it's a very special class that we will discuss separately on that. So, but remember that the bulk of the current chronic constipation, especially in the special group, which is the children and the older adult, right, are actually fall under the normal transit subtype. And this is actually where we call it functional constipation, where there's no known underlying causes itself, and thereby that the lifestyle, right, dietary changes, lifestyles are the prevalent first line of management option. Okay, I mentioned that the IBS, irritable bowel syndrome with constipation, this is a special case whereby that the person normally suffer from IBS itself. Normally, actually, they are having symptoms of diarrhea, but there are actually three types of IBS. One is actually IBS with diarrhea, I mentioned. The others actually is the IBS with constipation, right? IBS with diarrhea actually is the most popular one, right? Then the IBS with constipation is actually secondary. There are also IBS with mixed bowel problem, which is actually both diarrhea and constipation. Now, this is a problem due to the brain-gut dysregulation. Now, so very often, people who are suffering from IBS actually can be triggered by psychological factor like stress itself, right? So you need to actually understand addressing the problem, the constipation due to IBS is quite different from what we are talking about functional. But very often, people who suffer from IBS itself, we also actually apply the functional constipations management strategy on it. Okay, now what are the risk factors for constipation? Right. First of all, I think the dietary play a very important role, and therefore I think most of us who have constipation, you can try to resolve it by actually following this guideline. First, I think one of the risk factors is you drink not enough water. So if you can keep yourself hydrated, I think that they will solve a lot of your constipation problem. Also, another very common risk factor in eating habit is not having enough fiber in the diet, not eating enough vegetable or having enough fruits itself. So therefore, actually having high fiber diet will also help to ease your constipation problem. and also eating too much of dairy products, right? So if you are having constipation, right, and the constipation is not due to a medical condition itself, right? I think the first thing you do, try to correct all this habit and see whether it will help. Okay, now let's look at the secondary causes of constipation. These are constipation that have underlying cause, right? So it can be caused by having malignancy like colorectal cancer, ovarian cancer. You can cause constipation because of obstruction of the tumor to the passageway, mechanical obstructions itself, endocrine disorder, neurologic disorder, metabolic disorder like diabetics patient, right? Pregnancy also can cause constipation, and medication can cause constipation. All these are what we call a secondary cause of constipation, and all these factors can be addressed. And if you resolve this factor, then the constipation will go away. So let's look at the medical condition that can contribute or cause constipation. Here are the top 4 most common medical conditions that can cause constipation, and the prevalent rates are here. Right. First, diabetic patient itself. This have a high prevalent rates of 20 to 60% of diabetic patient actually having constipation. The reason for them having constipation is because the nerve damage of the autonomic nerve damage by the poor glucose control, sugar control, and as well as the diabetic medication side effect result in that. So therefore, once your autonomic nerve has been sort of damaged, then your control of your bowel movement is actually been also affected, and therefore this causes a high prevalent rates of a diabetic patient having a constipation. Right. Another condition that is very high prevalent rates are the chronic kidney disease. Right. This is very often, especially at the late stage of chronic disease patient, which is a stage 3, 4, or 5 itself. If you are in stage 4 or stage 5 CKD patient, very often you will require dietary restrictions, right? And you will have medications that actually require that affects you and can actually contribute to the constipation as well. So therefore, CKD patients itself is a very complicated cause of constipation, is because at one side is that you have to reduce the fluid intake. On the other hand, we know that if you don't have enough fluid intake itself, actually this is one of the risk factors for constipation. So it's a very dedicated balancing act and to manage a chronic kidney disease patient in terms of constipation. We will deal with it a bit later. All right. Then stroke patient, right? Patient with stroke actually will have a neurological damage, right, as a result of the stroke. And also the medicine that they take also can cause constipation. So very high prevalent rates of stroke patient having constipation. And at the same time, there's one condition in the thyroid side, which is hypothyroidism, right? The reduced thyroid hormones level will also slow down the gut motility, and therefore you're also resulting in constipation. So these are the 4 very common medical conditions that will have symptoms of constipation. And a patient that is having this under these medical conditions itself should actually try to make use of your dietary change and lifestyle changes to mitigate some of the constipation condition. Okay, so there are other medical conditions like mechanical obstruction due to the cancer tumor, right? Strictures, right? Neurological disorder like Parkinson's disease and multiple sclerosis, right? And also some multi-organ diseases like lupus and so on. These other conditions also actually basically affects the nerves and also affects the motility of the tract, GI tract. Okay, let's look at the medication. Now, it's important, I want to put it here, is that a lot of us doesn't realize that a lot of medication we are taking does actually have the side effect of a constipation. And therefore, it's important just to remind everyone that if you are on all this medication, and as a result, you're having constipation, the whole intent is not for you to stop the medication, right? Because the medication serves a much important purpose, treatment purpose itself, right? Your approach to the constipation actually is to relieve the symptom, right? That is where the supplementation, the dietary change, or lifestyle changes come into play, right? So, but remember, do not stop the medication unless you are told by the physician to do so. So let's look at some of the very common medication that can cause constipation. Among them, I think that you can see from here, overuse of laxative, right? This itself is a problem. So you use laxative to actually relieve constipation, but if you overdose it or use it over a prolonged period, longer than is necessary, actually you can have a reverse effect itself. Another one actually is people who are suffering from gastric reflux, so they tend to take antacid medication itself. So this medication actually can cause constipation. So this is a very common medication that we take because a lot of us are suffering from gastric reflux problem. All right. Now, if you are suffering from anemia and the doctors prescribe iron supplements itself, this is where the problem is. Iron supplement will also contribute and cause constipation. Antihistamines medication like cough syrup will also cause constipation. And most importantly, a lot of pain killer, right? And NSAID and opioids are actually, the side effect is actually constipation itself. So when you are taking painkiller, it's often that you also have symptoms of actually constipation. And do try to take in more water and actually have drink more water in order to relieve the symptom itself. Now, cholesterol, statin drugs itself also can result in constipation, and also our hypertension medication like the calcium channel blockers itself. It itself can also contribute to constipation. So you can see from here that I can tell you, most of us, right, would probably in one form or the other taking some of this medication daily, right? And it is important, first of all, that we do not discontinue this medication unless it's told. But on the other hand, we should then also make sure that our lifestyles and the dietary side itself try to mitigate the risk of constipation. Okay, now what other risk factors that can contribute to constipations? Here I mentioned a lot of the causes of it itself is due to the nerve problem, or actually the communication between the brain and your gut side, right? And therefore, stress is one of the major risk factor in the lifestyle part. So whenever you have stress, you are working under stress condition, right? You basically chances are that you will have a higher chances of having constipation. Not active, having a sedative lifestyle also can contribute to that. And also a change in diets and activities, for instance, the travel or shifting of house, all that itself. This indirectly contribute to the stress. And actually, as we mentioned, stress actually is one of the risk factors for constipation. Okay, now what are the complications of constipation? Here are the few very common complications that you expect. If you have constipation, you might resulting in anal fissure, which actually resulting in the bleeding of the rectum itself. Also, actually, it can result in hemorrhoids, the piles, right? And at a more severe case, actually, can resulting in fecal infection, which means the stool is stuck in the rectum there, and this can be very painful and very uncomfortable, right? And also, it can cause a hernia, right? And this is actually usually a painful, and usually the solution to that usually need surgical intervention itself. So these are the complications of constipation. Now, what are the management strategy? Right. So this chart basically presents to you the current clinical practice itself. Right. So once the constipation is identified, if you say that you're having a functional constipation, right? The first line of actually management strategy actually is to apply the non-pharmacological strategy, which means your dietary and lifestyle modification itself. Now, if this approach doesn't give you the results itself, then the next line of action usually is for you to ingest in bulk forming agent. In this case, you can take selenium fiber as an alternative to the synthetic bulk forming medication, or you have a laxative agent, which is actually you can take prunes and kiwi fruit for that itself. But if this is still unresponsive, that means that you are still having the problem, then we will resort to actually the medication part, which is actually the first line will be the osmotic laxative, right? Followed by, if it still doesn't work, then you will have prescriptive medication. Now, this area will be under the medical professional attention itself. But else, this two-stage, the first two frontline stage itself can be self-managed. So please, if you're having a constipation, try out these two stages before you seek a doctor. I think that that will help you a lot. Okay, the first line management strategy we have mentioned.
你跟温优一有没有去听啊 ？Because there's a talking about constipation， 你叫他去听。I send the link to her already.
Karen, you are having your voice on. Can you off it?
Please stop.
Let me see whether I can off your voice. Can you mute?
我朋友讲那个 newborn 的可以还给他。
Okay, it's mute already. Okay, all right. Sorry. Let's continue. All right. The first line management strategy itself, which is actually very often the self-management itself. First, drink plenty of juice, fruit juice, or water. Okay. So basically, don't drink sweet juice. All right. Juice, natural juice is best, and having plenty of high fiber food in diet. Now, in this case, I show everyone here what are the right amount of fiber supplement that we require. So you can see from here, on average itself, most of us would need at least 20 to 25 grams per day of fiber for effective, for normal, what I call management of constipation itself. So therefore, based on this, provide a guideline, then you should take enough. If you are taking supplementation, you should take enough of dietary fiber supplementation. In this case, take more than 20 or 25 is okay per day. All right. Now, another first line strategy in terms of the lifestyle changes actually is very important. It's actually the physical activities. Now, physical activities, especially like exercise itself, is play a very important role in actually preventing us from having constipation, right? The study result is very clear, right? In here, I show you, right? If you are just talking about adhering to international physical activity guidelines, which basically saying that you walk about 150 minutes of moderate walking per day, per week itself, you are able to reduce your risk of constipation by at least 13%. Right. So if you are having a more higher intensive, what I call activities itself, then actually your risk of constipation can be further reduced itself. So it's known, it's a known fact that actually physical activities help improve your mobility of your GI system, and at the same time actually can be a very effective first line strategy for preventing constipation. So try on the diet and physical activities as a first line approach before you take on any medication. Okay. Now, stress itself, I want to just share with you. We all know that the psychological factor play a very important part. Here, some of the statistics. If you're having mild depression, your risk of having constipation is about 1.5 times than a normal person, right? But if you're having severe depression, your risk of constipation actually is 2.3 times more, right? So, suppose any so okay, let me hold on a minute. Let me try to see whether the co-host Pauline side, yours CH side can try to mute off some of the members that they are not aware that their voice are on. If you can mute off, please mute off for me so that not to interrupt others itself, right? Okay, now if you look at it itself, on the average, if you are having a depression symptom itself, your risk of having constipation is twice the normal person that is not having. So important to realize that depression can cause constipation, right? So exercise actually is one of the very effective way to also reduce the stress, and therefore actually it does help to also reduce the risk of constipation. All right, now food. I think this is where the more interesting part itself. So we talk about eating fiber, drink more water. Then there are also some food that you should avoid if you're having constipation when you are suffering from constipation. First, try to avoid the fast food, processed food. Okay, alcohol, and then anything with white flour, processed meat, and fried food. These are the category that I will advise you to skip it if you are having a sign or symptoms of constipation. Okay, now it's a very interesting finding. Like, how many of you think that coffee will cause constipation? Right. Now that was actually quite sort of surprise for me when I tried to do some research on the drinks itself, and I find that basically this study, actually quite a reputable study, right? Have also indicated that comparing a never drink alcohol drinker and then the normal population that which include people who drink alcohol itself, the odds ratio, which means that the risk of having constipation itself, when you take coffee, right, and the coffee consumption as the coffee consumption go up, your risk of having constipation actually reduce. If you look at the never drinker of alcohol itself, the reduction of the odds ratio, the reduction, the risk of constipation actually reduced in a very progressive way. You know? So that means that basically, if you are drinking your coffee more than 3 cups a day, you have a chance of 80% reduction in the constipation risk. So coffee actually, in effect, moderate amount of coffee intake can be a very good strategy for managing constipation. So if you're having constipation, right, and you are really try out your dietary changes, drinking enough water, maybe it's still not effective enough, go and drink some coffee. But remember, caffeinated coffee, not decaffeinated, must be caffeinated coffee. This study basically indicates it's a caffeinated coffee itself, right? So even if you're an alcohol drinker, it still helps. It still helps. So you can see that the odd ratio is still lower. Okay. So another supplement that's useful and effective for people who are having constipation actually is in this study. This study actually they study among patients that's actually suffering from vitamin D deficiency and suffering from constipation, and check whether that their correlation with the deficiency in vitamin D in the blood level. So you can see from here that people who suffer from chronic constipation, right, are almost have very high incidence rate of vitamin D deficiency, which means that vitamin D supplementation is useful for people who are suffering from chronic constipation. So if you are looking for supplementation in terms of vitamin for it itself, please actually consider the vitamin D deficiency itself.
也会为不少人这个权利，包括孩子婴儿的财产、连外经，它不会让小辉带孩子不给经，而去剧院发生后 ，S 妈也发生了，在大 S 去世后
I
，S 妈始终没有道歉，
I think I
这不
cannot
是第
switch
一
off
次
this
发生。他悲愤说出，在他眼中，亲人跟欧巴这三个婚姻。
Okay. All right. Sorry for interruption. I'm trying to cut off the phone. I'm not sure whether the CH and Pauline, you all can do that. But I can do that now. I have to interrupt a bit. Okay, let's continue. Sorry. All right. Now, here are the non-pharmacological strategy for constipation. All right. So it's a very simple guideline. So whenever you're having constipation, regardless of actually the underlying conditions, it's good for you to actually try out this approach. First, increase your dietary fiber intake. Second, enhance hydration, which means drink plenty of fluid. Third, encourage regular physical activities, right? Now, you don't just run for a day. Try to have a regular exercise, physical activities. And then establish a healthy toilet habits, having good sleep and enough sleep, and doing stress relief. Now, healthy toilet habits means that basically have a routine of actually going to the toilet. But that will help. That will help as well, right? And then if all this approach itself, you still haven't get a result, then you consider the non-pharmacological treatments itself, which I will discuss here, right? So these are the options you have for non-pharmacological treatment in terms of diet. We mentioned already, start with high plant-based fiber diet. All these diet here, the fruits, vegetables, nuts, whole grains are actually high fiber, and therefore start with this in the diet side. Then the supplementation side itself, right? You can try selenium seed husk. Selenium seed husk has been studied, well studied, and they are one of the most effective fiber supplement. Currently, there's use for improving constipation. So, right. So I have listed here all the study that's been actually latest study itself. I wouldn't go through it, but basically just to show you that if you take selenium husk as a fiber supplement, take more than 10 grams per day, right? And allow it for about 4 weeks for the result to come up. So don't take it just for one day and expect immediate results, right? Take it for 10 grams per day and take it for about a month. So that this is actually a process of actually getting your system in place itself. So don't expect immediate effect by taking a short-term supplementation on selenium husk. Now, one of the very effective natural laxative here is actually prunes, right? And it's very safe because the prunes itself is a fruit, right? Have a lot of nutrients in that, and it is one of the most effective first-line, what I call natural laxative that you should try. So for anyone who has constipation, before you go and try the medication, right? Please go and give the prune juice a shot, right? Give prune juice a shot itself, all right? So then you will, in fact, this is actually more effective than a lot of some of the things that you do, right? So having prune juice coupled with having selenium husk fiber supplement, you will resolve most of the constipation problem. I can tell you that. Even those who have a very chronic constipation, a lot of my friends that are having this problem, right? When tried with prune juice, especially in the morning, right, in an empty stomach, you see the results. Quite effective, very effective, and it's very safe. It's very safe. And because of prune juice itself, the kids, especially for the special population, the kids side itself, kids taking medication is a challenge, right? But asking them to take prune, if they are like to take prunes, then you will help you a lot to help to resolve the problem of constipation. All right. Okay. Now, let me go through here. Other than the natural laxative of prunes itself, right? There's another supplement that we should take. And this supplement is probiotic. Probiotic actually, I think, has been discussed in many other conditions and useful, right? In here, I want to mention that probiotic also is an alternative treatment for constipation, especially for chronic constipation. There are enough large-scale study on probiotic in treatment as an alternative treatment in patients with chronic functional constipation already. So I leave it for you to go have a reference here. But important, same thing. When taking probiotic as an alternative treatment for chronic constipation, you must take probiotic longer than 28 days, which means that you must give it time. So don't take probiotic in the short term and then expect results, right? Try to take it for at least a month, right, to do that. Well, oh my, it's okay. We're having some fun here. Anyway. Okay. All right. Now, the pharmacological treatment side itself, right? I would say I will just mention it as a crossover. If you find that even the prunes is not effective, then you have to resort to actually a laxative. All right. Obviously, in terms of choice of laxative, you actually should actually go for the PEG. PEG is more effective than milk or magnesia for constipation, right? It's safer as well, right? But remember, if you are taking PEG, please do not take it more than 7 days. So it's a general guideline. PEG can be purchased OTC. So therefore, those who really want to go for a more effective treatment and you find the prune is not effective, you might go to pharmacy and buy a PEG for that purpose itself. But for the TCM side, there's also another alternative for constipation. And in this case, there's one herb which is called Angelica, Tang Gui. Tang Gui is actually known to be a very effective herb for constipation as well, especially for pregnancy constipation itself. So remember, in this case, our hemohin, right? Hemohin, one of the ingredients is also Angelica, right? Tang Gui itself. So therefore, you find that you do not have constipation problem when you take hemohin. So unlike a lot of people say taking hemohin might be hitty, but reality is that you do not face constipation problem when you take hemohin because Angelica, this ingredient itself, actually is anti-constipation. It's used in TCM for treatment for constipation in pregnancy, especially. Okay. Now, let's talk about the special population we mentioned. Right, there's two groups of special population that we are talking about. In fact, three groups, including pregnancy, is three groups. So let's talk about the first group, which is the children. The kids actually have a biggest problem, right? Of that. In fact, very common. I can say that in terms of prevalent rates, is up to 27% of children experience functional constipation during the grow-up stage, right? So what are the treatment options currently prescribed for children, right? So first thing is behavior and lifestyle modification, right? Toilet training. For those who are mother, please start early. Encourage regular toilet sitting, especially after meals. Do it as a habit. This will help, it goes a long way. Do that. Physical activity, try more exercise, run around. So regular exercise or having games, playing around can stimulate bowel motility. Don't let them sit, run. Go and play around, move around. All right. Hydration, drink plenty of water. Kids doesn't drink water. That's the biggest problem. Actually, a lot of kids doesn't know how to drink water. You all must try to encourage them to drink more water. Right. Don't drink sugary drink, but you can make soft drink or juice drink that they like, let them drink plenty of it, okay? This is very important. In fact, this is the first line of treatment option for constipation of children itself. In terms of dietary intervention itself, increase the intake of fruits, vegetables, and whole grains for in the diet for the children, right? Avoid constipating food, like limiting the dairy products and processed food, fast food, and so on, right? Cut down on all this food for the children. Basically, keep away the unhealthy food itself, right? And then children can take probiotic, and there's a lot of probiotic that's actually in the market. Not only the probiotic that Tommy have, but then I think that the probiotic is also very abundant in the market, like product like Yakult yogurt, all contain healthy probiotic, and they should take. This will help in the actually constipation problem for the children, right? So if you want to, if the constipation persists and you want to act on it yourself, you can try the prune juice, as I mentioned. For the children, they are safe, right? And then of course you can try to blend selenium or chia seed into the drink for them to increase the fiber intake as well. Those are the options you can do yourself, right? So rarely you need to go for actually more severe intervention. But then if the condition doesn't actually improve, of course, seek medical attention as well. Okay, elderly itself, actually the prevalence rate is about 26% of the women higher prevalence rate than men actually having constipation in the elderly side itself, right? So same thing, the dietary intervention side always aim to take 20 to 30 grams per day of dietary fiber. You mentioned that it's between 20 to 25. In this case, for the elderly, you can take up to 30 grams of fiber a day as a standard reference point, right? So fruits, vegetable, take it, and then obviously don't take it in all one go, and try to gradual introduction to minimize the bloating. Hydration, also important. Try to encourage elderly to drink 1.5 to 2 liters of fluids, right, every day, right? Unless you are kidney disease or heart condition, that we have a water retention problem, then obviously you have to restrict your fluid intake. Otherwise, if you do not have the all this condition, then you should take up to 2 liters of fluid daily, every day. And then probiotic, take probiotic as a dietary intervention. Probiotic is very helpful for that, and actually it's very safe, very helpful. All right. Behavioral side itself, again, same thing. Establish a routine, right? So usually we will encourage that go to the toilet after a meal, so that you actually provide a sort of conditional reflexes of passing the stool, right? And then if you can use a footstool to mimic a squatting position, which is the stool passage as well, if you need to, for the old people. Yeah, okay. Now again, physical activities, regular exercise can help and stimulate the bowel motility. All right. Laxative, again, prunes is the first line of option I recommend, and bowel forming laxative, selenium, chia seed, flaxseed. These are very fiber-rich supplementation that you can take as well. Now, important for old people, right? It's important to do a monitoring itself. They have constipation, but it's important that unlike the children, you need to monitor it, because that they might be red flags. Red flags are what? Weight loss, blood in the stool, or anemia. These are conditions that tell you that there are some other medical issue that need to be attended. So therefore, it's important that for constipated elderly itself, it is important that you regularly check your stool. Check the stool as part of the monitoring long-term care itself. Okay, pregnancy is a third group of special population, and prevalence rate is very high. First trimester, about 11 to 15%. In fact, you increase at the third trimester, actually is up to 40% of the patient have pregnancy, have a constipation problem. All right, so it's very high. Very high, it's very common, right? So in this case, as you know, when you are pregnant, you have to be very careful of all medication intake. And therefore, things that you take itself will affect the fetus, and you have to be very careful about it. So first, dietary intervention, increase the fiber intake. Same thing, 20 to 30 grams per day. At least maintain that as a standard. Hydration, you can drink more water, 2 to 3 liters of water daily, right? There should not be a problem for you to drink this amount and keep it to this standard, right? Regular habits, right? In this case, same thing, right? Have a scheduled bowel movement habit itself, and then avoid delay. That's very important, especially for pregnant lady, right? Important delaying the urge to pass out the stool itself. Physical activities, you need to engage in some physical activities, right? So in this case, walking, yoga for 20-30 minutes is okay. It's a good exercise, right? You do not have to engage in any aggressive exercise, but walking and yoga are good exercise for that, all right? Now, alternative and complementary therapies for constipation, pregnancy constipation, probiotic. As you say, very safe. You take it, right? Second thing, prunes is also very safe. Act as a stimulating laxative, right? Again, bowel forming, selenium, chia seed, and flaxseed. These are quite standard anyway, right? So therefore, if you look at it itself, almost all 3 groups itself, you cannot run away from probiotic, prunes, selenium, right? So apply on it. Use it. Very useful, and generally these are the first line practices, recommendation on dietary intervention. Okay, now just to round up on probiotic itself, I just sort of summarize all the studies that have proven that probiotic is effective for the special population like children, elderly, and pregnancy. Right, so it's for your reference. I'm not going to delve with it. Just trust that I can tell you that probiotic is a very wide spectrum effective supplementation that even you see for special population, all 3 groups are equally applicable. Okay, now let's talk about the Atomy Selenium Husk as a dietary supplement. Selenium Husk is a very effective dietary supplement. We mentioned already, as mentioned. So how much is the Atomy Selenium Husk contain? So in this case, right, 2 packs of selenium husk, which is equivalent to 10 grams of it, 1 pack is 5 grams, contains a total of 4.4 grams of fiber. So you make a judgment, right? So you mentioned that some of the daily requirement is 20 grams of fiber to 30 grams of fiber per day, right? So therefore, that is the amount that if you are not taking any other fiber in a diet, then you can use this as a basis. But of course, when we take food, food, we do have fiber. So you mustn't take this one directly. So that means it doesn't mean that you have to take supplement up to the 20 grams. You don't need to do that because I think that your food normally will contain at least 10 grams, 15 grams of fiber already. All right, but it's a reference point for you. The 2 pack a day serving requirement will give you 4.4 grams of fiber. Okay, now important in taking the selenium husk itself, right? We know that the effectiveness of it itself, it can help to improve your bowel movement, right? You can actually use for treatment of functional IBS constipation, right? You can take it to meet your fiber recommendation, which means that if you don't eat enough, you can take it as a supplementation, right? It also can help to lower your bad cholesterol, helps in weight loss, right? And help in your glucose control. These are actually the benefits of taking the fiber supplement itself. But one thing important is that consuming the selenium husk fiber supplement, you must take with water in order to avoid choking, right? So therefore, it's important to actually drink enough water when you take that itself. Now, overdose of the fiber without having enough water itself can also resulting in the adverse effect itself. It can cause bloating as well. It can also cause stomach cramp and so on and so forth. So be careful about that. So make sure that you drink enough water when you're taking the fiber supplement. Okay, now probiotic, as I mentioned, is a very effective wide spectrum product, right? So Atomy have 2 types of probiotic product: the probiotic 10 plus and the SCI. as I mentioned before, 10 plus have lower strength of probiotic is about 3 billion CFU per sachet, right? Whereas the SCI contain 10 billion CFU per capsule itself. But for the purpose of constipation, right, for Otomi probiotic 10 plus is more suitable than Otomi SCI micro, right? Just to for all the Otomians who want to recommend a probiotic itself, let me put it that way, because that this Otomic 10 plus itself in the powder form also have other excipient, other what do you call enzymes that is helping the body. Whereas SCI is a pure capsule form of a probiotic only. You don't have any other what do you call supplementary ingredients is in there. All right. So in here you can see from here the application. First, I put it there in highlight is functional constipation, right? Of course, it also can help for digestive health maintenance, or also can be used for indigestion, chronic diarrhea, enzemia in children, and gestational diabetics, which is diabetic during the pregnancy itself. It's very wide spectrum application for the probiotic powder itself. Okay, and the SCI are more useful for more specific condition, especially for infection diarrhea and all various types of associated diarrhea condition, and also for more severe condition like GERD, H. pylori eradications, IBD, and IBS, and so on. So, okay, all right. So this is the end of my session. I'll pass back to Pauline.